Hello, dentists and assistants. Um, I think it's probably about time that I really sit down and take some effort and care into talking about not only the mistakes and things that I've made over my career, and I've made many, but also the successes I've made as well, and underpinning the reasons behind them. So, the purpose of this video is to really help add some ideas into your arsenal. I'm sure you've all got some fantastic ideas, approaches, and philosophies to your clinical practice. And I just want to add some ideas and talk about some ways that you can really increase your skill set. And one of my strong suits, working as a general practitioner for the last 8 years, I've worked, telling you a bit about myself now, a bit of my history. Before I started my own clinic 8 years ago, I worked in about a dozen different practices. And what I did was I took the best parts out of those practices, I removed the bad parts, and I made my own custom approach to the way I systematically approach my dentistry. And my track record speaks for itself. I've got a very successful practice, which I've had for the last 7-8 years. I've got over 8,000 patients in my practice, and I do zero advertising. It's all word of mouth. My patient base is exceptional, so lovely. You know, if you ever spend time with me in my practice, you'll see the relationships I have with my patients. And some dentists can be quite abrasive. Some practices can be quite abrasive. It's almost like the dentist versus the patient in a way. I take a less abrasive approach, a collaborative approach with the patient, you know, a real teamwork approach with the dentist, with the staff, and also with the patient as well. And so I'm just going to talk freely and off the cuff here. And I want to talk about, I think, not just general dentistry, and obviously I have a focus in certain areas of dentistry now, but if you do decide to go in and have a focus in a certain area of dentistry, it's very important that you have also a good understanding of general dentistry as well. And from there, you know, you can use those skills to branch out and build a more niche, focused area of your day-to-day practice. So there's so many things to talk about, and I guess I really want to take the approach of communication. After I graduated, I felt that you were taught all the skills that you needed for your technical competency, your hands-on kind of stuff, but I felt that there wasn't enough emphasis on the big picture. Now, I think the difference between a good operator or a good operation and a great operation is the ability to zoom out. You know, Steve Jobs said that the truly intelligent people, not only they have the ability to adapt, they also have the ability to zoom out and have a look at the big picture. And I think part of that comes through really empathizing and putting yourself and living through the patient and what they expect. And getting to know the patient is incredibly important. One of the things I do in my clinic, and you feel free to reach out to me if you want me to send you any kind of materials or paraphernalia, but I mean, we'll just start from the moment the patient hears about you or hears about the practice. And patients use a multitude of things to select the dentist and the practice that they choose to attend. It's a very important topic. To choose a dentist, it's a very important matter. You know, think about dentistry. It's your personal space. You know, you're letting someone into your personal zone, and people are very selective about who, and also very proud about who they go and visit as a dentist. and they want to be proud of their dentist. And I mean, the most influential thing on what a patient uses to select their dentist is what their friends and family tell them. And so they use a multitude of other things, from perception to, the external of the practice. Is it clean? Is it neat? There's nothing jumping out at them. They're not given a reason to not attend. Obviously the reputation of the practice is, incredibly important. There's other small things as well, like, advertising and online reviews. These things all form the perception, but the most important thing is what they're told by their friends and family. So from the moment the patient walks in the door, a great dental practice, it has a feeling about it. Just 1 second. There's a real feeling in the air. And the staff are happy to be there. The staff don't take their problems with them to work. From the moment the staff walk in the door, and the dentists, they have a resilient ability to shut things off. I'm walking into work today, I know exactly what needs to be done. I'm pre-organized. I know what the day's looking like. I have the day schedule, I have my to-do list, I have my checklists I know that need everything that needs to be done. It's all documented, I don't need to remember it. It's very important to, and in the day-to-day runnings of the practice, things can get hectic. And you might say something to a patient, you're going to follow up, and then you might forget. Always keep something handy, whether it's a set of sticky notes or you've got your own to-do list pad or something like that, where you tell a staff member, all right, remember this. You should only need to remember once, and that's just to remember to write it down. Once it's written down, then you're going to follow up on those things. So one thing I say to the dentists, and something I do, this is all stuff that I do, is be prepared. Whether it's the night before or that morning, go through the book. If you haven't got access to the book, you should have the ability to log on remotely and go through your schedule. What patient needs what. Every practice, patient has a different set of requirements, this patient needs a little bit of warm water for her scale and clean. This patient can't go back in the chair too much. This patient has a strong gag, gets a sore jaw. All incredibly important things that you need to have front of mind before you walk in, and your assistants need to be aware of that as well. Keep in close communication with your assistants, and you should send them the book at the start of the day. Send your assistants the book at the start of the day. Give them probably a voice recording. I find that most efficient. Efficiency is incredibly important. Voice memos and WhatsApp I find incredibly useful. You may have your own tools for that. Make sure everyone's prepared. Then you're walking into a day that's fully predictable. And when everything's fully predictable, stress levels are low, enthusiasm's high, and you can cruise through your day working efficiently. There's no dead gaps and dead spaces. The appointment times are appropriately booked out. One thing I do the week before every week, I do it every Wednesday, is I'll go through the following week and I'll look at the appointment times, because when the reception staff book the patient in for a certain amount of time, they don't know precisely how long each appointment's going to take. It's really the decision of the practitioner for how long, but at the time when the patient booked, things got caught up. They already brought the next patient in. They didn't give a chance to tell reception exactly how long each appointment was going to take. They might be booked in for an hour for stage 1 for an anterior tooth endo, but the appointment might only take 35 minutes, 38 minutes. So one thing I do as well is I stretch the appointment books out and I work in 2-minute blocks, and then I might bring that scale and clean from 30 minutes down to 22 minutes. You have to obviously factor in, if you're only working out of one room, you need to factor in the time obviously for the nurse to set up and change over. And then you're working efficiently. Because I think what can be defeat the morale of a practice is when you're sitting around. Mums aren't in the chairs, you're sitting around, they're chatting, it's not productive. And you know, and you talk crap, and it's not productive. You'd rather go into work, get all the work done, and then get the hell out. You know, you might have a break in between, but you don't want to be sitting around on your bum twiddling your fingers. The purpose of dentistry is to really set yourself up so dentistry serves you in your life. That's the way to make it sustainable. That's the way that you can last long in this profession without getting burnt out. So, you know, efficiency is incredibly important. So all right, back. The patient walks in the door, the staff are prepared, there's no surprises, and they walk in, they're greeted by friendly staff members that are all organised, and you know, they sit down, they get their new patient form as an example. Let's say they're a new patient. Now, I think one thing that can really differentiate you as a practice and as a group is having a very comprehensive new patient form. Getting them to fill out. I've got a 3-page form with my clinic, and by the time they sit in the chair, I already have a profile of the patient. I know where they live. I know how they heard about us. I know if they have health insurance or not. I know about their medical history. I know when the last time they visited their dentist, what it was for. Are they a regular attender? Do they have pain today? Is it severe? What are they hoping to achieve out of today's appointment? Rarely, they could be in pain, but they just want to know. They just want an assessment. Sometimes they don't want to, they want to get most of the time, they want to get their pain sorted out on the day. You know, what did they like about their previous dentist? What didn't they like about their previous dentist? All of these little idiosyncrasies form a very important profile that you can put as a pop-up alert. You remind it every time they come in, and all these things help formulate the treatment plan. So you've got a list of questions as to the patient's daily habits. What are their daily habits? Do they drink water? Do they know how to brush their teeth properly? Do they floss? Do they grind? Do they snore? Have they ever been heard stop breathing when they sleep? Been diagnosed with sleep apnea? What would they change about their smile? Are they concerned about any spaces within their teeth? All of these things form a very incredibly important profile. And then they've got the consent. Do they know how much the appointment's going to cost? What's the appointment for? Have they signed it? Do we have their permission to, discuss with their medical health practitioners and all that? Once they're signed, it's in. And you've already got an incredibly valuable profile of the patient. Then, patient walks in the room, everything's set up. Is it a comprehensive exam? Is it a limited exam? Is the X-ray unit activated? Is the PA up, ready to go? So that form's very important, and that really will differentiate you from, the other practitioners. This is the way for us to get from a good practice to a great dental practice. Communication is incredibly important. There's so many little communication tips and techniques that I'm going to talk about today, and they're all really important stuff. So when patients, let's go with the phone calls. Before we start going into when the patient's in the chair, dealing with them clinically, what about phone calls? I have found that the most effective way to handle phone calls is, firstly, if they're a new patient, that is the most important patient call to take, because it's someone who could potentially go up the street. They may want something now. They have to call a practice. The phone calls have to be answered quickly, usually within 2 or 3 rings, in an ideal world, and it's not always ideal, we know that. Patients usually want to know what the cost is. Something you can say to patients is, well, your examination is going to cost X. They don't want to know if there's hidden fees a lot of the time. How much is an extraction? How much is a root canal? How much is a filling? Well, give them a range. Give them a wide range. You don't want to. You want to give them a really low and then a really high, and say, look, the doctor needs to make an assessment. We need to make an assessment. How much is an extraction? We need to take a scan. I don't use the word X-rays. I use the word scan. We need to make a scan and make an assessment. Was there extra money for a scan? Look, it's going to cost X amount, regardless whether we take a scan or not. And then you'll know what your options are at the end of that. How soon, when patients are in pain, how soon would you like to come in? Or questions like, is there a time or day that works best for you? Just look to close. A lot of these phone calls, some of them like to have a chat, but you just get them in the door. Get them in the door. Give them a range. And sometimes they'll, and this is something you can use all the time, is that when you give them a quote, is that expensive? You say, look, we're not the cheapest and we're not the most expensive. We're somewhere in the middle. We think we're incredibly good value. Another question that you can ask over the phone, how did you hear about us? Oh, that's very interesting. Well, most of our patients are referred to us through word of mouth, so we're always very interested to hear how patients heard about us. And a lot of the times they will be word of mouth. A good practice has high word of mouth referral patients. And patients like to hear that about the dentist. Oh, it's mostly word of mouth referral practice. And you say, oh, we don't do much. We don't do any advertising, or depending on the practice, we do very little advertising. So it's always just interesting to hear how patients heard about us. And if they say, oh, my friend told me about you, say, oh, that's always nice to hear. They're a very lovely, yeah, I know Mrs. Jones, she's a very lovely person. Everyone loves Mrs. Jones. It's always nice to hear that feedback about us in the community. It's very important to us. There's no greater feeling these are some communication things you can say. There's no greater compliment we can ever receive than when a patient refers their friends and family to us. At the end of the day, we are a business, and we do rely on word of mouth referral clinics such as yourselves for our success. And that just really paints a strong picture for the patient before they even walk in the door. And how good's that? So, but having good frontage and good signage, clean website, informative website, updated decor, or just clean decor, clean room, nothing, there's no dirt and stuff. The area's hotel clean. We want to get the practice hotel standard clean. It is a health clinic, and the cleanliness of the practice is incredibly important. The smell of the practice is incredibly important. I like to have music in my practice. I like to play, some nice music. And it's nice to work with music too. Sometimes you might get a patient that says, I don't like this music. So, well, you're only here for 20 minutes. We have to work here all day. So it's very important that you're working in a good environment, comfortable environment. You're not feeling like you're at work. You're there to have a very efficient, pleasant, predictable day in a team that has a lot of respect between each other. All of the staff and all of the team members have a real mutual respect. We've got each other's back. I've got your back. And if we do have feedback to give to staff members, which is very important, don't embarrass other staff members in front of other staff members. Don't ever do that. Bring a staff member to the side and say, can I just talk to you in private for a second? And give them the feedback. And just be direct and be honest about it. But don't embarrass staff members ever in front of other staff members. It's not necessary and it's inappropriate. Most of the time, you don't even need to give feedback. People know. You don't need to. You certainly don't. You should never scold the patient. Scold your team members in front of the patient. Don't ever do that. You might give them a little nudge or a little tap on the foot or something like that. But perception for the patient coming in is incredibly important. You always have to be organised. You always have to be perceived as everything's under control. Even when it's obvious that you're busy. Geez, you're busy, doc. Oh, I'm busy, but it's orderly busy. It's not chaotic busy. We're very lucky. We've got systems for everything here. Another thing that's incredibly important working within a practice is the style of language that you use. Always using positive language. When you're talking to other staff members, always use your manners. Always use a please and thank you. Thank you so much, great work. Compliment your assistant in front of the patient. Compliment the dentist to the patient. Dr. X has done such a good job, it looks so good. You know, these things really just reiterate to the patient they chose the right place. Another thing as well is if it's the first time a patient's come to the practice and they're having a procedure done, always for the first patient, if they've never been there, take photos before and after, or photo of the cavity, or it's very close to the nerve, and show them the after result. You know, they can't see what's happening with their teeth. It's like a mechanic. You don't know what they're doing with your car. Don't make them trust you. Let them verify for themselves. Show them. Let them do the examination. Let them see what the issues are. And then you could make the argument, well, you know, they don't know what they're looking at. Well, they can, because you can put some baseline photos up on the wall of what a normal bite wing looks like, what a normal OPG looks like, what a normal set of teeth looks like. And then they can, Mrs. Jones, your gums used to be up this high around the neck of the tooth. You can see on yours they've dropped back because you've got build up underneath the gums. The gums are shrinking away. If you leave it, now I'm just going to share something with you here. A very important, this is more for the dentists, a really nice thing you can say to patients, and at dental school you're aware that you should always give the patients the option of doing nothing. Well, you don't say it like that. You say, well, you've got one option is to do nothing. Well, if they're in pain, no. Say, look, you can use questions like, if you want to save your tooth as long as possible, and asking them their goals is incredibly important and putting that in the treatment plan. Most patients aren't asked that question. And when you ask a patient, what are your goals long term? What would you like to achieve long term? They go, wow, this practitioner's they really care about me. Most of them have never thought about it. And I say, I want to keep my teeth as long as possible, a lot of them. I want really white, straight teeth or something like that. You say, and then you can talk their language. It might be fear. I want to be put to sleep for everything. You know, then you can talk their language. I'm really worried about the money. I don't want to have to spend good money after that. Then you can talk about the money side. You have to talk the patient's language. Once you understand what motivates the patient, you can talk their language. And then they're super impressed. Not only will you get higher, more low resistance case acceptance, but they know that you care about them. You're listening to them. You should always listen to the patient. And not only for the patient, but for yourselves. You'll save yourself a lot of time during the appointment. If you actually ask the patient, they come in, it's a new patient exam. Oh, well, how can I help you today? I've got a chip. I want to check up all my teeth. Okay. Any particular issues you're having? I've got a chipped tooth up the top right. Okay. Anything else? I've got one bottom left. Okay. Anything else? Sensitive gums. Okay. Keep asking. Anything else? Anything else? Until they say, no, that's everything. And then you repeat them back to the patient. If a patient has to repeat their problems to you more than once, they know you haven't been listening. So it will save you a lot of time, then you repeat it back to the patient. All right, Mrs. Jones, we're going to have a thorough check of all your teeth today, if you don't mind. We're going to have a thorough check of all your teeth today. I'm going to take a look at that top right-hand side tooth that you broke a few months ago. That's not causing any pain. I'm going to have a look at that sensitive spot down the bottom left-hand side. You're getting some sensitivity when you're drinking cold water. You've had it for a few months. And I'm going to have a look at and I'm going to have a look at all your teeth. Is that okay? I'm going to put some gloves and mask on here, and then I'm going to start the examination. Now, I find showing patients photos incredibly important. Letting them do the examination. Do your exam. A lot of times you'll get butted in halfway through your exam. You haven't finished the exam. I can see you've got a broken. Oh, that's a broken. Oh, I can see. Oh, yeah, you've got a broken tooth there. First, sometimes I say, what do I do about it? I don't know yet. I don't need to finish the exam. Well, I don't know yet. I just need to. I need to go through things a bit more carefully. I'm not sure. That's okay to say that. I'm not sure. And then after you finish your examination, you say things like, if you could please excuse me just for a few minutes here, I just want to go through everything carefully and make sure we cover everything nice and thoroughly. Remember, when you're treatment planning a patient, examination, special investigations, radiographs, diagnosis, caries risk, fracture risk, CPI score, oral hygiene, systematic. Everything's systematic. You've got your own systems. My system is, for the examination, take history from the form, then examination, TMJ, muscles of mastication, okay? Intraoral, soft tissue, throat, tongue to the left, tongue to the right. I'm looking for any lumps or bumps that shouldn't be there. Don't say cancer check. Review the periostatus. Check the teeth. Take full mouth photos. Take bite wings. PAs if needed. OPG. Full zoom out. Coming in. Writing down the problems list. You've got what motivates the patient. You've got some things about them that you've already got from the new patient form. You've made them a customised oral hygiene form, specific to their needs. And then, priority. 3 parts of the treatment plan. Priority. Disease control. Elective. Priority. And the priority is always what their first presenting concerns. I've got a broken tooth, top right hand side. Step 1, fixed tooth, top right hand side. Sensitivity. 2, Sensodyne application around the gum. 3, And then when you reel off the treatment plan, you always deal with their main concern. The first thing that they told you, you deal with that first. Then you deal with the second point second. And then disease control. And then always look, some patients, and all right, they're nervous. Do you give them a sedative? Do they want GA as an option? Do they want IV sedation as an option? We provide IV sedation in all of our clinics now, by the way. And then the patient might be time poor. All right, do you want it all done in one visit? It's up to you. We can space it out over a period of time. Always make the default spreading the treatment out over a period of time. Extend it. This is all expensive stuff for the patient. It's not cheap. They've got other things going on in their lives. They've got bills, some have got kids, home loans. Try and spread it out. Look, we can do this over a period of 12 months. Wow. He cares about me. She cares about me. Elective. And after we've done all that, long term, some of these teeth will crack or break in the future. If they do, we'll deal with them. Then they'll need crowns. Or that tooth that we can do a large filling on. Or if you really want to keep your teeth as long as possible and you really don't want to save, you should have crowns on these teeth. You can do that later. Get the most important stuff done first. So that's how we formulate a holistic treatment plan. And man, you've got them for life. You have got them for life. And then you explain it to them. Go through the treatment plan, you show them their issues. And if they've got no issues, you say, I've had a look at everything. I had a look at your jaw, your soft tissue, no lumps or bumps, all your teeth and everything like that. You just need a good clean. I had a look at everything. Which is great news. I don't need to see you until, don't say 6 months. You should be seeing patients every 6 months, in my opinion. I don't need to see you until May. I'll see you in 6 months' time. No. Don't need to see you until May, which is, it's a positive spin. I don't need to see you until May. Yeah, for your regular cleaning of the gums. I need a scale and clean a topical fluid. Don't talk the jargon. No one cares and they're not impressed. It's insulting. You're insulting a patient when you talk jargon to them. You can talk it to your assistant, that's fine. Keep it simple and talk the patient's language to them. And by the way, you talk to if a patient's a help and they want to know, you talk the jargon. If they like the jargon, give it to them. But don't insult an 80-year-old lady by telling her that she's got a carious lesion. I don't even know what a carious lesion is. You have a hole in your tooth. If you want to keep your tooth as long as possible, we have to clean it out and build it up. We have to clean it up and fill it in. Keep it simple. Keep it simple. A lot of the times they'll say, what's involved there? What's involved if we fix it? Well, what we're going to do first, most of the time they're afraid. What I'm going to do is I'm going to give you some I have to give you local anesthetic for this. I'm going to get you nice and numb. I'm going to get you nice and comfortable. I'll give you lots of local anesthetic. Really take our time. I'll test the tooth before we get started. Anything uncomfortable at any point, you pop your hand up and I'll stop. You know, you're indicating to them that they're in control of their procedure with their tooth, fixing their problem. You're the fiduciary helper, which you're not obliged to do. If you're uncomfortable at any point, pop your hand up and I'll stop. Very simple. And you know what else is very valuable when you talk to a patient, you start a procedure? All right, Mrs. Jones, you're going to feel some pushing here, here's some noises, anything uncomfortable or anything like that, you pop your hand up, so you start the procedure. So you touch the tooth, or you spray air, or you do a pulp test or something to confirm their anesthesia, or you start pushing on the tooth, or whatever you're doing, then stop immediately and you say to them, are you okay? Okay, if you're not, this is how you say it, this is the voice tone. If you're not, and I mean it, you let me know. Okay, very simple. That's how you say it to them. And when you do it, you put a non-intimate touch on their shoulder. Okay, it's a non-intimate area. If you're not, and I mean it, you let me know. Okay, very simple. Wow. They will be your cheerleaders for life. Give them lots of time for the local to settle in. Really take your time. Go out while the locals kick in. Do some notes. Something like that. Go into the other room if there's a spare room. See another patient. Test the tooth. If they're not numb, you give them more local. So what's happening? Right, so you're explaining it to them. What's involved there? So you can have some things up on the wall. Let's say you're restoring a tooth or you're doing a crown. We polish it back and then we fill it up again. And you show them on the wall. And you can, that's what's involved. And you always give the patient the risks. Now, like any procedure, there's always risks, okay? And it depends what you're talking about. But let's say you're restoring it. There's always a chance you could lose the tooth. There's always a chance it might need an extra procedure like a root canal. Or this is how you do it. There's always a chance that I might need to refer you to a specialist. Sometimes things that can pop up that we don't expect. Occasionally I might need to refer you off to see a specialist if you'd like, if you do really want to save the tooth. Like any procedure, there's always risk. There's always a chance the piece of tooth can be left behind, or a piece of tooth can go down into the nerve or up into the sinus. And, for every 1,000 teeth I do, 1 in every 500 gets a complication. In this instance, remember, you never tell the patient they've just got a little cavity. It's just a little job. Oh, it'll only take me 5. No! It's their problem. You have to under-promise and over-deliver, always. So when you're showing them an example procedure on the wall, show them a small procedure being done. So when they look at the photo of their tooth and it's a bigger issue, they know that they've got a problem, there's a risk. It's their risk, it's their problem. Don't own their problem for them. Make sure that they own their problem with their tooth. Your tooth is broken. You have a big break in your tooth. You have a hole in your tooth. If you really want to keep the tooth as long as possible, that's the option of giving them. If you really want to keep this tooth as long as possible, we can do X, Y, Z. Or, look, you can go and try and save this tooth if you want, but realistically, it's not worth your time and your money. You're going to keep getting issues with this tooth. Even if they've got a little root stump, tell them. They might not know that it's hopeless. It's not worth your time and your money trying to save. Realistically, you're going to end up spending thousands and the tooth's going to have to come out later anyway. The best thing that we do is we take it out. These are just some things that you can use, adding tools to your arsenal depending on the clinical context. And, when you're polishing off a restoration or something like that. Close your teeth together. So you do on that side. Close your teeth together. Your teeth bind together normally on that side. You have a feel on your tongue there. Any rough or sharp areas? No. Does it feel okay? Should always feel okay. Now, it will take a while for it to wear in, whether it's a crown or a root canal or a restoration. It will take a while for it to wear in naturally, but if the anaesthetic wears off and it feels a bit hard or a bit rough, we can always polish it off for you next time, no problems. Occasionally, it's not unusual to require an adjustment appointment. It's not unusual for the tooth to be a bit sensitive afterwards. It's not unusual. Your teeth will feel different after the clean today. You will notice little gaps and spaces between your teeth. That's how it should feel. Your teeth may be sensitive. Sometimes everyone's a bit different. You might be sensitive for up to a month. If you are, just take a bit of Sensodyne, or any issues, give me a call. Make sure you take a bit of Panadol, something like that. Post-operative instructions. Because what you're doing there is, and you should always tell the patients the risks before. Before it's a reason, after it's an excuse. Always under promise and aim to over deliver, and tell the patient. Look, I always tell patients to, and I tell patients this. I say, look, I like to I like to always get you to expect the worst, then anything else is a bonus. And man, they respect that. Now you're starting to sound like a health professional and a health practitioner to discuss the risks. Discussing risks is very important because you're not selling a steam mop. It's healthcare. And when you're telling the patients the risks, you're not owning the problem for them. Never be invested in their decision. Be invested in providing full consent and a range of options, but never care more about the patient's tooth than them as well. Never be overly enthusiastic about fixing their teeth. I tell patients, I say, look, at the end, I say, especially to the kids, I say, look, at the end of the day, I can tell you to brush your teeth now, but when I go home, all I'm thinking about is myself. They're your teeth. You're going to have them for the rest of your life. And statistically, you're going to live until you're 80 or 100. This is the last set of teeth you get. Once you polish it back, it doesn't grow back. Or once the tooth breaks away, it won't grow back. If you want to keep your teeth as long as possible, you need to do this. It's up to you. It's up to you. And you should always feel comfortable with saying that. It's up to you. Whatever you'd like to do. Sure. I'm not really sure. Well, why don't you have a think about it? If you're unsure, you should have a think about it. And you have any questions, you let me know. We can book you in for next week and you can decide next week what you want to do in that appointment. It's up to you. What would you like to do? Oh, I need to have a think. All right, have a think about it. I'm going to go into the other room now, see another patient. You have a think about it, you let me know. Well, that's expensive. We've got payment plans. All really important stuff. Wow, that was such a good appointment. Oh, thanks so much, Mrs. Jones. Well, I couldn't have done it without my fantastic assistant. Always give the credit. Never take the credit for yourself. And when they give you credit, it's a trap. Don't take the credit. Give it to your team. It's because I've got my, one of our world-class assistants with me today. He or she makes everything so smooth. And we just have such a great working relationship. My assistant is just an absolute pleasure to deal with. We love what we do, we're focused, we look after ourselves, and talk about yourself. Talk about the things you do to look after yourself. Talk about how you come to work prepared. Talk about the fact that you aim to get a good night's sleep. You drink a lot of water. You try and eat healthy foods. You get a bit of exercise. Talk to them about the things you do to maintain a really good work-life balance. Talk to them about, tell the patient that you never take things personally. It's not personal. Imagine if I did take it personally. I don't take any of this personally. I'm nervous. That's normal to be nervous. Well, it's common to be nervous. You're not the first person, you won't be the last. Oh, I've got to, And when a patient's got a small mouth, or they're very sensitive teeth, or they gag a lot, you say, oh, I've got the same thing too, I know how it is. They don't feel isolated. They don't feel alienated. You know, you got their back. You know, and man, you know, that's such an intangible feeling that patients get from you, and that's what gets them to tell their friends and family about us, raving about us, and that's what separates us from the average. So yeah, I mean, look, we'll talk more about this stuff later. I'm going to have a little rest now, and I might do a part 2 later. Okay.